Right, I think we're live now.
Yes, I think we are.
Right, so hello
Hi, guys.
everyone. We're on two feeds here, down here on YouTube, up here on Instagram. I'm Gyles.
I'm Vanetta.
We are those Morrison.
Yes.
So today we have decided, considering there's all this nonsense going on with COVID-19,
Yeah.
a lot of fear, a lot of panic, a lot of stress.
Yeah.
There's also quite a lot of people who are absolutely carefree
Yes.
and not worried at all
Yes.
when they should have some amount of worry.
Yeah.
So we've decided we're going to do this live Q&A specifically to combat a lot of the fears or tensions that people may be having about COVID-19.
Yeah.
Get a little bit more faith going.
That's it.
Actually tackling a lot of the facts and making sure any fears that people have are going to be extinguished.
Yes.
So that's the plan. We're going to be on this for probably about an hour. We're thinking.
Well,
hopefully that's going to be enough.
Yeah.
Yeah. I think we should be able to get through enough information in that time.
Exactly. Just saying hi to those who've already joined us. Hi, Odette. Hi, Tisha. We're seeing you.
Yep.
Thanks so much for joining us.
And please do leave comments. Any questions that you have. We're happy to take them.
Yeah.
So the first thing that I want to talk about actually is just how serious is the current situation.
Yeah.
So there is actually quite a useful website that's been done by John Hopkins University and Hospital in the US, which has looked at all the number of total confirmed cases and how many people have sadly died.
Yeah.
But also how many people have recovered.
Yes.
So it can sound quite worrying, you know. In isolation, these numbers are going to be worrying. So I'm looking here again, and it's just a live stream that you can get into with this, right? It says there's 236,384 people have been infected. Okay, this is the total confirmed cases of infection.
Yes.
And I want to highlight that the number of people who actually have COVID is going to be much greater than this, and we'll talk about this in a bit.
Yeah.
So the total number of deaths are 9,790, and to put things into perspective, about 1/3 of those deaths are from China alone. The other thing to highlight is that even though all those deaths, most of those deaths, 1/3 of those deaths, a significant amount are from China, is specifically where COVID-19 was first identified in the Wuhan province. Around that area and the rest of China, we're looking at 0 to 10 deaths on average. It's not that many people.
Yeah.
Which highlights that China was really doing a damn good job when they were able to contain it.
Yeah.
And then we look at the total number of people who have recovered. That's 84,960 people. This is a huge number of people.
Yeah.
Just to highlight the fact that people are recovering because actually it's not fatal. It's not fatal for the vast majority of people.
Yeah.
But we will talk some more about why you have to take COVID so seriously. Because I think the another thing that keeps coming up why people think that it's not so serious is they keep saying, well, look how many people are dying from, HIV over the years, or Ebola, how many people it's affected them. And it's like, well, the problem with COVID-19 is quite complex.
Yeah.
But there is some simplicity to all of this. So it's complicated because everyone is quite scared, and there's so many people having to change their way of working and how they're now having to look after their children at home. There's now concerns that, you can't go back to work. How long are you going to take for you to be able to go back to work? There's concerns that, if you're elderly, you can't come out of your home. So there's all of this talk, and it's for the simple purpose of we don't have a vaccine for the disease.
Yeah.
So we can't cure it. And there are a minority of people who are going to get so sick that it will kill them. Now, this number of people who are going to get so sick and it can actually kill them is significant because that's why so many hospitals are struggling. They don't have enough equipment to give fairly to everybody who is sick and needs it. That's the main reason why everything is just turned so stressful. Is because if someone gets sick and they will need a respirator, ECMO,
Hi to those who's
ventilator.
joined us now.
Yeah, hi there. These people are the ones who are going to suffer because they don't have enough equipment for all these people. That's the reason why this is so bad. The truth is that the vast majority of people who will be infected with COVID, and I will admit, it's a lot of people are going to get infected. There is, high probability that could be 50 to 70% of the population of most countries will be infected at some point. And I would argue that about 80% of all those people who do get infected, it will just feel like a bad case of the flu or bad case of just a common cold even. This is really important to keep in mind. We are not worrying that most people will die of COVID. You should not be stigmatized thinking, oh no, I've got COVID-19, I'm going to die.
Yes, it's not an STI, guys.
It's not an STI.
If you've got COVID, you've got COVID.
This is it. It's a respiratory disease, okay, that is spread just like the flu would be spread or common cold would be spread.
Yeah.
So based on that, actually, what you need to be focusing on is how can you just try and not get it and actually protect those who are most vulnerable.
Yeah.
So we are going to talk more about the facts. But Vanetta, please do share some of your thoughts on how this has actually been affecting you.
Yeah, I think from my perspective, and especially something that we obviously was important to us to highlight is the perspective of faith. You know, we are Christians, and so we have our own kind of perceptions going into all of this. And I'm not talking about any conspiracy theories or whatever else. I'm talking about actually, as Christians, what should our stance be in this situation? What should we be believing? And you know, one of the things that one of the reasons why we're kind of talking about this in the first place, as Gyles has said, is the seriousness of the situation, but also because we strongly believe that leaders are there to guide attention, and all of us are leaders in our own right, in our own way, be it in our community, in our businesses, in our whatever families. We all have some sort of leadership in our families. So I would say that it's important for us to understand the facts of the matter, and it's important to us to remember how our faith plays a role in this, because we are actually guiding the attention of other people. We're guiding the attention of the community around us, of our family, and all of that type of stuff. So yeah, when it comes to faith, the one thing that came to me, and that was a scripture that we'd put out in the post yesterday to kind of advertise this live version. Hi guys, nice to see you. Was with regards to 2 Timothy 1:7 talks about, for God has not given us a spirit of fear, but of power, of love, and of a sound mind. And I think those are the things that we really need to remember. Those are the things that have come to me as well, with regards to the fact that, okay, if God has given us a spirit of power, you know, we need to remember that we have authority in the spiritual through prayer, through declaration. We should be praying for wisdom for our leaders. It's so easy at the moment to kind of just swear at people because some of our leaders are really moving sideways.
There's a lot of nonsense coming from our leaders, and we will be talking about why scientists have been so against what a lot of the leaders have been saying.
That's it.
Carry on.
But what we need to remember, there's no point us cussing them out. It's not really helping them. What we need to be doing is praying for wisdom for them, praying for scientists to find the vaccines effectively, praying for unselfishness when it comes to the distribution of vaccines, because we've heard about that already as well.
So just to pick up on that, if you're not already aware, there has been talk that Trump wants to try and get exclusive rights to a vaccine for the US citizens, utilizing a laboratory based here in Germany. So those who don't know, we actually live in Germany now. We used to live in the UK.
So
it's ridiculous. You can't treat people like that, thinking that you have to have, only the Americans can have a vaccine, not the rest of the world.
Oh yeah, or whichever country would be saying that behind closed doors. We're just praying for unselfishness when it comes to that. Praying for God to bring a swift end to this, you know, and for people who are alone or afraid, just keeping them in our prayers. But we also need to remember we have authority in the physical, kind of through exercising our gifts and our talents for the sake of our families and for the sake of our communities. So is there any food shopping that you can do for vulnerable people right now, people who might not be able to go out and do their own shopping, you know, and do it in a way that obviously maintain social distancing and all of that type of stuff when you drop off the food shop for them? Or is there any way that you can provide help to people who have to kind of reschedule their entire lives? So I've seen people offer their virtual assistant services, for example, which is brilliant. Can you provide any practical help remotely? And if yes, how can you do that? And then again, looking at, medical, mental health training, is there any way that you can support people in that, even if you're not based in hospitals, for example? So that's the power side. It's the spiritual authority and it's the physical authority. The love side is from my perspective, very easy. Stop being selfish, start being salt and light, and more like Christ. Just connect with people remotely as much as we can, love on people. Just kind of be around people. And then the sound mind perspective, again, from a Christian perspective, is finding that balance of not letting our fears dictate our reality, because we are people, we live by faith and not by sight. But at the same time, we can't pretend like there's nothing happening, and we can't pretend that we can't be minimizing people's experiences. We need to be serious about this. People are actually dying. People are actually losing their jobs, their income. People are actually, worried about how to feed their families and how to house their families as well when income stops flowing in. So let's not minimize it and just kind of put a plaster on it and just say, God is in control. Yes, that is true 100% of the time. But at the same time, it's also looking at how can we practically help people.
We can all act at this moment in time. We all have the ability to do something. It's a choice.
Yeah.
And there's a lot of people who, with their so-called sound mind, are making bad choices. So let's tackle one of these first myths. I would say there's this myth that this virus will just deal with itself. No, it will not. Okay. If we want to have people staying healthy, the only real way that we can do that is by having a vaccine, or by keeping people clean so that they don't actually get the infection in the first place. And if they do get the infection, that they're isolated.
Yeah.
That's just the simple facts of it. You can't just have the virus out there and everything will be fine. People will die because not everybody can fully recover from this. And this ties in with another really important myth rather. There's this myth that actually, if you're young, it can't kill you. That is the biggest load of nonsense ever.
Yeah.
There's two main reasons to think about this, okay? You can't guarantee that a virus doesn't kill someone just based on age. Just like you can't guarantee that someone will die of the virus just because of a particular age.
Yeah, I saw a story about a 102-year-old.
Yeah, 102, 103-year-old. They've recovered.
Yeah, had corona and has recovered.
They recovered
a few days. So yeah.
And a big reason, and we're going to be talking about this a bit later, is that there's plenty of other things that was being done in that person's lifetime, which meant that they already had a good enough immune system that when the virus did come, that they were okay.
Yeah.
They were able to recover from it.
Yeah.
So this myth that actually if you're young, you're safe. No, there are people who are in their 20s who have had COVID-19, who have had to be hospitalized and had to be ventilated because it is just too serious for their lungs.
Yeah.
So dealing with one of the questions that we've got, who's this from now?
This is from the
Whites.
Yeah. Is it true that a Wuhan doctor has found a stem cell vaccine that appears to work?
That I don't know to be true. It doesn't really make sense that this could have come actually from just a stem cell. It should really be coming from actually dealing with the virus itself. So just very, very small, quick crash course in vaccine creation. You're wanting to basically find something that can create antibodies in the body, something that can trigger the creation of antibodies in the body when you give that injected to somebody, or you give the person the actual antibodies in the vaccine. And that needs to be based off of the actual virus itself. So one of the ways we do that is get the virus, chop it up into tiny bits. So it's not a live virus anymore. It's chopped up and the body senses it and it starts to create antibodies and it fights that infection. Okay, or at least fights, the antigens that come from that particular bacterium or virus, whatever is creating the infection for that human being. So just getting it from a stem cell wouldn't make sense. You would have to get it from the actual virus itself. Hopefully I'm not saying any terrible science. It's been quite a while
you
since I
better check that.
had to deal with all
you better
this.
check that up. We're here to give people facts.
Yeah, but one thing to highlight about this though is with regards to a vaccine, there is a vaccine that is being trialed at the moment. Last few days, there's things going on in Seattle in the US. There are healthy adult volunteers that are testing it out to see how people react to it. But it's still probably weeks to potentially months before that vaccine could come out. It still has to be seen that it's not going to harm humans, and that takes time, unfortunately. And
by the time, even if it got developed next week and got shipped around the world miraculously by next week, still a lot of people within that week would have been infected, unfortunately. So obviously, like we said, we're hoping that the vaccine will be found as soon as possible, and will be able to be used as soon as possible. But in the meantime, obviously, there are country-specific guidelines that we need to follow. As we mentioned, we don't live in the UK anymore, so Germany's guidelines are different to the guidelines for the UK and might be different to the guidelines for the US or wherever you might be living, or France, or wherever you might be living. So you need to identify what the guidelines are for your country from reputable sources, and make sure that you follow those guidelines. Okay, do we have some more facts? Oh yeah, we had here a comment talking about, I saw somewhere someone said prayer and potatoes go together. I think I saw the same thing, and yeah, absolutely agree. It needs to be the spiritual and the physical, practical working together. Faith without works is dead, guys. So
this is it.
Okay, have we got keep the questions coming? Keep the questions coming.
So there was another question that came to us specifically around is it still safe actually to give blood at the moment?
Yes.
So generally speaking, if you have an active infection, if you are unwell, you should not give blood. The two reasons is you could contaminate the blood, and the other reason, which people actually kind of forget, is that after you give blood, it makes you feel really, really rubbish. Can be quite lightheaded and weak. So actually, it's not safe to give blood whether you had COVID-19, a more conventional flu, or any other infection for that matter. So I wouldn't advise you looking to give blood if you actually feel unwell. Specific guidelines though on when you can and can't give blood can be found if you visit your local blood bank.
That's it.
And so this, for the UK at least, I think it's the NHS Blood and Transplant Service. So you should be able to find some information on that for a quick Google search.
So we wanted to touch a little bit also on, we've had a comment from Tracy Tress about lockdown in France since Saturday midnight. Yes, we are obviously thinking of you guys in France and Spain and Italy and all those other places that have been locked down, praying with you, and obviously for yourselves as well, putting on this session to kind of let you know that we're out here, we're thinking of you, and obviously we can still build community online, thankfully. So yeah, we had a couple of questions with regards to symptomatic versus asymptomatic, as well as immunity. Do you kind of want to touch on that?
Yeah, so it's very easy for there to be a lot of new terms used whenever we have outbreaks and stuff like that. So the first big one, asymptomatic and symptomatic. If you are symptomatic, as the name kind of suggests, you have symptoms, so you'll have some sort of complaint. And in fact, technically, when someone has a symptom and you go to a doctor, the symptoms is what you as a patient would complain to the doctor or the healthcare professional that you're seeing. So this would include, for example, the common ones that we've talked about is fever, and particularly a high fever. Okay, so it's not the fever where you just feel a little bit uncomfortable and there's times you still want to cover up in the bed. We're talking about the fever where you feel that you might want to pass out. And in fact, there was a story about a doctor who, and this is the thing to keep in mind, is that this is a doctor who's been trained. They know about disease, but they had a high fever, 39 degrees, and they felt short of breath, and they're asthmatic. So they took their inhaler, went to cook, and then woke up to the fire alarm going off. So that is an indication of when to go to hospital, and we will talk a bit more about that. So symptomatic will be any symptoms that you're having. So
for COVID, it would be the fever, the
shortness of breath. So it's actually, you find it difficult to breathe. Your breaths the breath that you're taking is short. That's the whole point of it. You're taking shallow breaths and having a
Coughing.
cough.
Yeah.
Quite a dry cough normally.
Yeah.
And that's happening because the infection is going quite deeper into the lungs. So asymptomatic is that you've got the infection and you don't present with any symptom, that you don't have any complaints. Or if you do have a complaint, it's to say just feel a little bit unwell, a bit under the weather. And this can happen. There will be people who have asymptomatic infection of COVID-19 and they just plod along and may not even notice.
They don't notice, but they are passing it on to others. And this is again why the context of why social distancing and self isolation is kind of being considered by most countries now, because you might be plodding along happily, not knowing that you've got the virus, and coming into close contact with people and passing that on to them, and they then become symptomatic. Hence why we're told to restrict our contact with the elderly or anybody in the vulnerable group, because you could actually go away never even knowing you had COVID, but suddenly somebody gets ill after they've connected with you and get severely ill. So that's
right. I think the other thing to highlight is this whole idea that if you are going to get sick, is it okay to just stay at home once you're sick? And it's like yes and no. The main reason you're staying at home is that you don't infect somebody else. Okay, particularly those who are vulnerable, and these vulnerable people are the elderly, people who already got a low immune system, which could be anybody. This is the thing, when it talks about anybody with a low immune system, it could be someone who's got active cancer, someone who's recently had chemotherapy, someone who's diabetic, someone who actually already has an infection. Think of your white blood cells as soldiers. If loads of your soldiers already gone to battle and then there's more soldiers that come against you, where are your soldiers to face this impending army? So
this new enemy.
And this is the thing, you actually already been sick. If you already got pneumonia, you already have poor lungs, you already got diabetes, anything that's already weakening the body, these are things that are going to make you more vulnerable. Okay, so the best thing really is just avoid getting the infection in the first place and avoid spreading it to other people. So stay at home. The other big one is this whole concept of flattening the curve. So a lot of people have heard about flattening the curve. The curve is referring to the number of active cases, people who are actively infected and sick with COVID-19, okay, as well as people who are asymptomatic. So it's everybody who is infected with the disease, okay? And there's going to be a point where it rapidly goes up. And we've seen that in China, we've seen that in Italy, we've seen that going across Europe now and in the US. There's a point where it was just 1 or 2 people that were sick, 1 or 2 people affect 5 people. So 2 people suddenly becomes 10, and it just exponential growth in the increase in the amount of people who then continue to get sick. Now, what we're talking about when we're saying flatten the curve is to get to that point where the peak of the curve, where the most amount of people are sick, becomes a smaller amount. Okay, because when you have a large number of people who are really sick, you're then raising the chances of some of those people being really, really unwell and needing more advanced treatments in the hospital. And that's what's putting strains on a lot of healthcare systems. So to flatten the curve is to basically reduce the amount of people getting sick. So those who do get sick isolate themselves so they don't infect anybody else. And those who are well isolate themselves so they're not got a chance to get sick in the first place. So those are the main concepts behind flattening the curve. If you're able to flatten the curve sooner rather than later, overall the number of people who could potentially die will go down. Significantly can go down. That's why we talk about flattening the curve.
Okay, before we move on to immunity, we've got a question here with regards to what is a dry cough? Does this mean no phlegm?
Generally speaking, yes. It's a cough where the cough itself makes you want to keep coughing, but you can't bring anything up. And this is common for even just a common flu, to be honest. There's a lot of times you can have the flu and you don't actually have that much of a runny nose. It's really just in the throat. So I think in general, you shouldn't be worrying too much on whether it's a dry cough or a wet cough. It's more so is, if the cough is so bad, am I able to breathe? And if I can't breathe very well, can I actually function like this at home? Now, when we talk about when is the time to go to hospital, this I think is probably amongst some of the most useful facts for people, is to think about logically, when should I go to the hospital? So let's think about this. If you have a fever that's so bad that you can't get out of bed, you can't feed yourself, and there's no one there to help you, you could potentially deteriorate, get worse, and die. That sounds like a good reason to go to the hospital.
Yeah.
Furthermore, if you have a cough that's so bad that it's extremely difficult for you to draw a breath, or when you do take a breath in, you struggle to get a breath out, which is a common symptom of someone having an asthma attack. If symptoms like that are happening, eventually you're not going to be getting enough oxygen into your body, and it could kill you. You could pass out, you could die. That's a good reason to go to the hospital. So think about it. If you are sick at home and you cannot look after yourself, you're getting so unwell that you can't function on your own, these are reasons to go to the hospital. If there's no one there to help you, that's the time that you should be thinking, okay, I'm going to go.
Yeah. Okay, right. Keep your questions coming. In the meantime, we're going to talk about immunity. Are you immune if you've had COVID?
So the answer is we don't know. In my opinion, I think we don't know. The main reason being is that there has been a case, at least one case. If you do enough Google, you'll probably find some more. There's been at least one case of someone who has had the infection, recovered, had the infection again. We don't know what that means fully, to be honest. And it's not been a common occurrence, but it's the fact that it's happened should make you think, well, actually, if I've been sick, I should be just trying to keep myself healthy. And this is where this whole idea of 14 days comes into play. Actually, it can actually just be like a week that you need to recover for some people.
Yeah.
Even just a few days. But generally speaking, if you've given yourself 2 weeks, the chances of you being infected again or the chances of you still being sick are going to be a lot lower. That's why they're saying 14 days. But if you are still sick for those 14 days, don't let day 15 be the day that you're going to decide to go for a run. That doesn't make any sense. You still have to rest and heal, fully recover. There's no pressure for you to be going back to work or, having to do that. I say that actually, incorrectly. Some people are going to get pressure to go to work, to be fair. Some people are. But generally speaking, if you're too sick to work, you should be doing what's necessary to keep yourself healthy and stay at home.
Yeah.
So the other aspect of immunity is that this concept of herd immunity, this is where a significant number of people in the population are immune to a disease. That means that you could no longer get an epidemic or get a pandemic again from this. And we'll talk more about epidemic and pandemic in a bit, but herd immunity can come from people getting the infection, getting the disease and recovering, or by being vaccinated. So most people are vaccinated against measles, mumps, rubella, things like that. And that is a good way to ensure that most people won't get the infection in the future by being vaccinated. But we can't do the vaccination route. And there's been talk, particularly in the UK government, that we want to get herd immunity. But herd immunity, the old-fashioned way, is going to kill people because, and this is another really important thing, when we hear about the total number of cases of people being sick and actually confirmed to have COVID-19, there's loads more people that have it. There's always loads more people that have it. Because think about it, that person didn't get sick at the very precise second, the moment that they got infected. They got sick days to even a couple of weeks later. What have they been doing all that time between getting infected and actually being sick? They've been kissing and hugging people and shaking hands and, on public transport, doing all kinds of things around all kinds of people. They could have spread the disease to who knows how many people. And that's why you have to assume that if one person is sick, it could be anywhere from 1 to 100 people more are sick as well. So when we talk about, there's maybe 250,000 people infected with COVID-19 in the world, it's probably a few million people are infected. Now, that doesn't mean you should be worried. It just means that there's a lot of people out there sick. what are you going to do to try and stop yourself getting sick? Or if you are sick right now, just stay at home and focus on healing. That's the priority.
Yeah. I think I want to touch on some of the kind of mental health facts and some of the mental health fears, because obviously this is a trying time for all of us, really. But it might hit some of us more than it does others. And as Gyles has said, you know, it is a pandemic, meaning it's global rather than local to one country, which is the difference between a pandemic and an epidemic. So you are allowed to feel scared. Absolutely. You are allowed to feel anxious. You're allowed to feel overwhelmed. Don't dismiss those feelings. Allow yourself to feel the feelings. But then at the same time, we need to take into consideration, there comes a point where you can't just keep your head in the sand. There comes a point where you can't just let complete panic mode take over and stall your life, because we kind of have to find a way to do life in this madness, whilst we hope and pray that normality sets in as soon as possible. You know, so we need to make sure that and especially as an adult, especially as someone who has responsibility over others, if you're a carer, parent, manager, partner, whatever, like it's necessary for us to kind of have our moment with our feelings, but then look at, okay, what is next? What are kind of the practical things that I can do? You know, and again, obviously from a mental health perspective, I'm like, okay, anxiety is one of the main things that probably is going through the roof for a lot of people right now. Some of you might not know what the symptoms are, but symptoms of anxiety are things like difficulty breathing, feeling on edge, feeling dizzy, heart palpitations, shortness of breath, which is incidentally also a symptom of COVID itself, headaches. There's so many physical symptoms of anxiety that can affect you long term, and so that's why we want to help to work with anxiety, and also to work with general boredom that you might have. So on Monday, I brought out on Blueprint Way. So Blueprint Way is where I coach and counsel, a framework that's around 4 R's to reduce anxiety during this pandemic. So we'll share it again over that Morrison Life as well, but just as a reminder, so there were 4 R's. The first one is reframe. And so ask yourself the question, what can you be grateful for? Because gratitude is one of the most powerful reframing tools. It kind of takes us away from the, oh my gosh, this is the end of the world, to actually there's still so many things that I can be grateful for. And so, yeah, ask yourself, what can you be grateful for? Swiftly followed by, actually, what can you control right now? Because like Gyles said, there's so many things that we don't necessarily know, that the politicians don't know, that the scientists are trying to figure out right now. We can't control everything. We don't have the answers to everything. So let's focus on the things that we actually can control at the moment. The second R was refocus. What are your current priorities? Are there maybe things that you need to switch up as priority? Are there things that maybe, you know, you've been so focused on, you know, making money or whatever else, or getting that promotion, whatever else, and maybe neglected your health, maybe neglected family, maybe neglected whatever else. Maybe this is an opportunity for you to kind of take stock and reflect on, actually, what are the things that are important to me? How do they match with my bigger vision? Actually, the things that I'm focusing now, are they really worth focusing on? The next is reconnect. Who are the people that are most important to you? How can you connect with them, obviously from a distance right now? Make sure that you're investing into your relationships. It doesn't take that much effort to pick up the phone and ring someone, or to go and FaceTime someone, or whatever, WhatsApp video call people. And the fourth is rest. Actually, is there a way that you can take some time to slow down a little bit right now? Of course, not everybody's able to work from home, and I'm very mindful of the fact that, you know, a lot of us are saying work from home, but not everybody is able to work from home. But is there a way to maybe slow down a little bit right now? And if not, especially if you're on the front line, doctors, nurses, teachers, and all of those people who are essential to helping our society kind of just tick over, what are the self-care routines that you're using to look after yourself at the moment? You know, can you just take a bath? Can you just go and, you know, listen to your favorite piece of music or whatever else? There's so many musicians giving free concerts over Instagram or other platforms at the moment as well. So have a look at, see how you can connect with the things that actually just allow you to rest, and also allow you to just have fun.
And if you're not already aware, you can now watch Frozen 2 if you've already got access to Disney Plus in the US and the like. Us in Europe will be getting it from the 24th of March, but it's coming at least 3 months early. I haven't seen Frozen 2. I don't know if I'm excited yet. I don't think I'm allowed to be excited for Frozen 2. But
anyway,
yeah.
so the one point that I wanted to make with regards to mental health and anxiety, or just coaching, you know, I've asked you these questions and you're like, oh, I need someone to help me sort this out. If you need any help processing this, I'm currently offering a 50% discount on all my hourly rates, all my packages for the next 30 days. I think it's really important for you to have someone to talk to. So just contact me, have a look at what I offer under blueprintway.com. And there's also the amazing people like Melanin Minds Therapy, who's currently on the live IG as well. So find her, Melanin Minds Therapy. Check out Talkspace. There's loads of places that are able to help with dealing with anxiety or help you just get your life on track.
Yeah.
You know, you might have realized, oh, I've got so much free time to write a book or do whatever, and actually I don't know where to start. So I'm here, I'm available, and I'm happy to help.
Mm-hmm.
Got some more questions. So JT Fit, what? Oh no, that was the dry cough. Oh, and he said, thanks for this, guys, very valuable, an absolute pleasure. Mm-hmm. Tracy Tressa said, why do you think some people are not taking it seriously?
Right. So
well.
Right. So I'm gonna take a lead in this one, yeah?
Yeah, that's fine. Let's remember that we're not cussing our leaders.
No, but still, right. Listen. Trump, yeah, you are playing a dangerous game, Trump. Really dangerous game. You don't believe that COVID-19 is that serious because for whatever reason, probably because you're president, you don't think you're going to get sick. But COVID-19 is serious because there are elderly people, and Italy has a lot to speak up about this.
Yeah.
A lot of elderly people are dead because we've acted too slowly.
Yeah.
Now, there is this idea that because coronavirus is so similar to flu and that most people don't actually die of flu, that actually most people won't die of COVID-19. The thing is, and this is a huge difference, right? There's two main things that makes the common flu different to coronavirus, different to COVID-19. The first one is that the most vulnerable people in our communities who have access to vaccinations are vaccinated. People with chronic conditions, the elderly, pregnant, so on and so forth, these people are vaccinated against the flu before flu season comes.
Yep.
Flu season, depending on the country that you're in, is normally between around late December, early January, all the way up to around March to May. It really differs in different years, okay? So this is why people tend to get vaccinated in October and November, okay? But there is no vaccine for COVID-19. So those vulnerable people are more likely to just die from it, okay? The next thing to keep in mind is that because COVID-19 is a new virus, most people have not already got immunity to it.
Yeah.
So some people will. Just very, very quick thing about immunity. The body is always making antibodies, okay? And these antibodies are already floating around the body. And there are chances that you already have got antibodies that can fight COVID-19. You have no clue to know if you do. And trust me, it's not worth trying to figure it out. Okay, just try and avoid the infection.
Yeah.
But that is why some people might get the infection and just don't get sick at all, or they'll get the infection and have an extremely mild version of the cold. Just a little bit of aches and pains, maybe a sore throat, and then 12 to 24 hours later, like particularly after having an overnight sleep, they feel completely well.
Yeah.
So there's too many people, such as Trump, who's speaking up, suggesting that actually there's nothing to worry about. Like, for example, I'm really disappointed that Trump will celebrate that we've got Roche, who's able to do all this testing for him. Millions of tests can be given to US citizens. And then he says, but you don't actually need to be tested. Now, that sort of contradictory statement confuses people. And people who already respect Trump, which is your choice to, you may then be convinced that what he's saying makes sense. The truth is that there are a lot of vulnerable people in the world who will die. Like I'm not mincing my words right now.
Yeah,
there will be more deaths.
Yeah, just to kind of highlight the epicenter in America, or where it started, Seattle, was actually a nursing home, And the death toll is so high because a lot of the people within the nursing homes passed away.
Yeah, that is the reason why death tolls are high, because often, most of the time, it's the elderly that are dying from it, because those were amongst the most vulnerable people. You know, I can't even fathom how Italy is going to recover, knowing that about 3,000 people have died, most of which were elderly people. There's a significant amount of knowledge and experience that could have been passed down to the younger generation, and their light was just snuffed out prematurely because people are not taking it seriously, thinking that actually the infection is not that bad. I'm young. I'm not going to get sick. You have a responsibility to keep healthy for those around you. That's why you have to take it more seriously. And also because there is a chance that it could kill you even if you are young. You don't know that actually this dry cough that you've had for years was actually fibrotic lung disease. And it's only been recognized and diagnosed because you caught COVID-19 and you're in your mid-20s, and then it's been too much for your body and it's killed you. Don't learn the hard way. You don't want to learn these lessons the hard way. So a myth. There's been a myth going around that, or rather there's been posts going around. It's not quite a myth because the true answer to it is a little bit complicated, but generally speaking, there's been this idea that paracetamol can fight fever, and ibuprofen can also fight fever, but ibuprofen is actually causing people to die of COVID-19. Hello. Now, it's a load of nonsense. Ibuprofen is not going to cause you to die of COVID-19. There are some people, though, who, if they have ibuprofen, it can harm them. This is people who are asthmatic. In particular, there are people who are asthmatic who can have a reaction to ibuprofen, which can actually make it difficult for them to breathe. There's also a situation where people who have ibuprofen can cause gastric ulcers, you know, sort of holes and ulcerations of the gut, of the stomach, of the small intestine. Okay, but that's less important because it's not the respiratory tract. Now, in those situations, obviously don't take ibuprofen. But ibuprofen and paracetamol together is a very, very, very powerful antipyretic if you have fever. Antipyretic, sorry. Dropping medical terms there. Antipyretic, or something that causes pyrexia or gets rid of pyrexia, is an antipyrexic. Okay, this is relating to fever. Pyrexia is fever. It's a medical term for fever. So having paracetamol, it will help to reduce fever. So can ibuprofen. If you are in doubt, speak to your GP, speak to your family doctor. Okay, you don't feel forced to take medication that you don't feel comfortable with. But it is very common for people to be taking ibuprofen and paracetamol. That's why it's so easy to buy it in the United Kingdom without prescription, because it's quite safe if you take the normal doses of it.
So there was also, we've had a comment, Tracy Tress, in France, they recommend to take only paracetamol and to avoid ibuprofen.
Yeah, I think the thing with ibuprofen is that if you've never taken ibuprofen before, okay, whereas paracetamol is quite harmless for most people unless you're already allergic, ibuprofen, if it's not taken correctly, if you take it on an empty stomach, it can cause gastric ulcers. Okay, that's why there's a lot of people who do take ibuprofen or on a type of antacid that can reduce the amount of acid in the stomach, so that when you have ibuprofen, because one of the side effects of ibuprofen is that it ultimately can increase the amount of acid compared to the amount of mucus lining the stomach. So it's getting a bit gross now, but normally there's a bit of mucus, like what you would have from phlegm, lining your stomach. That is there to protect the stomach from eating itself. If you ever wondered, how comes the stomach doesn't actually digest itself? That's the reason. The stomach acid is digesting the mucus before it can digest the stomach lining. If you take too much ibuprofen, it's going to remove the mucus, start burning through the stomach. That causes the peptic ulcers. And this is why a lot of people are not supposed to take ibuprofen unless you're taking some sort of antacid that can reduce it. But this isn't, you know, chemistry for you to be playing around at home. If you don't know about this stuff, seek medical advice on the best treatment to take. Because as much as I'm a trained doctor, I'm not going to tell you, as everybody listening, take ibuprofen.
Exactly.
I know for a fact that it's quite harmless, because otherwise you would not be able to purchase it for yourself. But actually, cigarettes can be purchased, definitely without a prescription, and those are extremely harmful.
Yeah.
So, if you have concerns, it's best not to take the medication.
Yeah.
Paracetamol will help. And for sure, if the fever is so severe and you don't have even paracetamol at home to deal with it and you're deteriorating, go to the hospital.
Yeah. So there've been some myths around, and I guess in a way also by scientists potentially saying that actually warm weather can negate the effects of COVID, and that COVID is not heat resistant, can be destroyed by heat and things like that. What are your thoughts on that?
So, like most microbes,
keep your questions coming.
Yeah, like most microbes, it can be affected by heat, but it's not just the regular heat of being outside. If it was as simple as that, then no one would ever catch flu in hot climates. For sure, there's people who have been sick and dying of COVID in Thailand. There's going to be places where people can be very, very unwell.
Yeah.
So just assuming that heat is going to be enough is not. And we've got to use a bit of common sense here. The WHO is the leading authority on health. That's why they're called the World Health Organization. If they're saying to you that the main steps you should be taking is washing your hands, it's because it's true. Those are the most important things for you to consider, is sanitation of your hands. Washing the hands is better than using alcohol gel. Alcohol gel is alcohol. It's going to dry out the hands. You need to use hand moisturizer. And the way the alcohol gel is working is that it's actually destroying on a chemical reaction the bacteria and the viruses that's on your hand. Washing your hands is using friction of the water, friction of your hands, especially if you follow the proper step-by-step guide of washing your hands. That is the best way to prevent COVID, because if you haven't washed your hands and then you're like, ooh, go rub my arm, pick up my nose, and
we have washed our hands.
Yes, have I? So, and this is another reason why we keep talking about not bothering with the masks. But everybody keeps saying masks, and you've probably already heard that say, don't worry about the mask. There's two main reasons why you shouldn't bother about the mask. Okay? The first one is, if you have a mask and it's not a well-fit one, you're actually going to put yourself in a false sense of security that the mask is the only thing protecting you. And then you keep going on fixing the mask, touching your ears, which is actually connected via the eustachian tube to the rest of your nasal and all orifices. So that can then drain into the nose, into the mouth, from the eyes. All of this is then meaning actually you can get COVID even when you're wearing a mask. If you didn't have the mask, you probably wouldn't be touching your face anywhere near as much. The next big reason is that actually, if you are already social distancing, you're keeping yourself at least 1.5 meters away from people, or you're just staying in your house, okay? You're not going to have the chance of someone coughing in your face. But if someone does cough, right, and you've got the mask, okay, it's going to keep that going away from people. So there's the benefit. Is if you are sick, if you are actually around somebody who is sick and you don't have a mask, of course that could increase the risk if you're close to them. Like if you actually get real up close to someone and let them sneeze in your face, of course you're going to have a chance. But who is actually doing that in normal day-to-day life? I can't remember the last time I had someone sneeze in my face. Why am I so close to them in the first place?
Well, that can happen at work sometimes.
It can happen when you lay in bed with your wife, actually.
It can as well. That's not happened here.
It hasn't. So this is why you shouldn't worry about the mask. You should worry about cleanliness. Keeping your hands clean. Keeping away from people who are actually sick in the first place. Right, we got another question or statement here.
Comment from Aminata Online. It's been said that over 70s, those with underlying health conditions and pregnant women are the most vulnerable and at risk at this time. But what about small children? So
small children, it's a bit complicated. So just like I was saying before, is that you can have, antibodies in the body, and they're always being made, and you never know what antibody is being produced and what pathogen it could fight. But generally speaking, babies could be most vulnerable, especially if they haven't been able to get antibodies from the mother's breast milk, which is even more pertinent if the mother was sick with COVID and she made antibodies. You can go in the breast milk and actually protect the baby. Now, if, say, for example, you're around pets, or you have young children who are now starting to walk, they're going to start building their immunity very, very quickly, because as soon as they put their hands onto something, the hands then go in their mouth.
Yeah.
So the
Germs.
body has to start fighting whatever is going into the body. So they're building their immunity, and the older they get, the stronger their immunity is. Okay. But generally speaking, the things to think about, and this is why schools around the world were not being closed as soon as we heard that COVID-19 was going around, is because yes, they are going to be more vulnerable, but there's steps that you can take. Even this is why we said before, this 103-year-old person recovered. If your nutrition is good, if your diet is good, balanced, you get enough fluids, enough sleep, keeping yourself generally healthy, this actually is what's going to make sure that even if you're elderly, you're going to have a much higher chance of recovering. Same as if you're a young child.
Yeah.
Now, if you're a newborn baby, it's common sense. You don't put newborn babies in front of someone who's sick. When mothers give birth, they're not telling sick people to come to their house and start kissing up their babies. You don't do that. You keep babies away from people who are sick in general. It's no different for COVID-19. So the same fear that you might have of your child getting sick based on being around someone who's got the flu or common cold is the same fear that you would have for COVID-19. COVID-19 is significantly worse.
Yeah.
In that regard.
Yeah.
Okay.
And that's what's being said by research as well. Some children and babies aren't more vulnerable to COVID than adults necessarily. But obviously you're going to try and keep them safe as much as possible.
Yeah. Because they don't talk the way that we do. They normally just cry.
Yeah.
And so it's very distressing for them when they get sick because they can't be fully consoled. And that's another reason why it's good to just try and prevent them getting sick in the first place, because it's so difficult to get them to be settled because it's all just distressing for them.
Yeah.
So yeah.
Right, we've had Rudes 88. So thank you to so much, guys. This was very informative and useful. A pleasure, dear. Tracy Trust is saying apparently there was a case in the UK of a baby born with COVID-19. Oh.
So that I don't know about. I don't really know how that's possible. The reason why I say that's quite complicated for that to be true is that it would have had to transfer over the placenta and gone into what would otherwise be a sterile environment in the amniotic fluid that the baby's sitting inside the womb. Now, if the membranes have been ruptured, I would love to know how a disease that's transported and transferred to other people, normally through like spit or from nasal secretions, how that would be able to go into a womb. So I'm a bit worried about how that could even happen, but I've not.
Well, we don't know. We'll have to
for sure haven't heard about that, so I can't comment.
We're getting used to
exactly.
So if you see me scared, it's because I feel like everything's going to collapse in a moment.
Yeah.
Okay. Yes, Tracy Tress also said yes, nutrition is important. Yes, Tracy Tress, our nutritionist on the Tricky Nutrition and dietitian at Tricky Nutrition. Nutrition is important. You need to stay healthy as you would for anything else. You need to have a balanced diet. You need to have good physical health. So even though you're at home and can't necessarily make it to the gym, try and find a way to do your routines at home, exercise routines at home. Get some fresh air on your balcony.
And vitamins and minerals, it's always wise to take extra vitamin C. I think most people, I would say most people are not vitamin C deficient, but you could always do with taking some more vitamin C. And you normally need to take quite a lot of vitamin C.
Yeah.
Most vitamin C that you take, even from orange juice, let alone from supplements, will just pass through in your urine. So for you to actually have a high concentration in the body, you need to take quite a lot of it. But always speak to your doctor when you're looking to start taking supplements to make sure it doesn't have any adverse effects. For most people, there will not be adverse effects from taking supplements off the counter. That's why it's so easy to get them.
Yeah.
But be wise about this. If this is territory that you're not familiar with, speak to professionals. They're there for your guidance, for your support to make the best decisions about your health. But yeah, good fluid, nutrition, sleep, rest, all these things how to de-stress. These are things you need to keep in mind.
That's it.
Regardless of it being COVID-19, just for normal good health. These are things to keep in mind.
That's it. Yeah. We've got some time for a couple more questions,
Yeah.
but we will be winding down shortly. So if you've got any more questions, feel free to let us know.
Yeah.
Thanks for the questions that have come so far, and thanks for letting us know that the advice has been useful.
Yeah, pleasure.
But yeah, good to see you all. And yeah, we'll just summarize where we've been.
Yeah, COVID-19 is something for you to take seriously. Unfortunately, there will be more people who will sadly die from COVID-19. And this is because there's just so many people being infected, and there's chances of some people being so unwell with it, going to hospitals that don't have enough equipment, that some of them are just not going to get the treatment that they need.
Yeah.
But through social distancing, through keeping yourself healthy, applying the common sense and best practice of maintaining good health, keeping away from people who are sick, washing your hands. These are ways that we're going to be able to flatten the curve, reduce the amount of total cases, total people who are infected with COVID-19.
Yeah.
And eventually we will get past this.
Absolutely.
As more and more people get sick, more and more people will recover. Sadly, with that, people will die, but more and more people will recover until, on balance, the vast majority of people are immune. This is what eventually gets to what's known as herd immunity. And we will get to that point sooner when a vaccine does come. We know that a vaccine is being trialed at the moment, being tested out in clinical trials. And when that can be released in the weeks to come, we're going to be able to flatten this curve much, much quicker.
Yeah.
Yes.
Yeah, and just to summarize again, from a mental health perspective, you are allowed to feel all the feelings that you're feeling, be it anxiety, panic, overwhelm, whatever it is. But remember that there are people out there that are able to help you and support you in processing that. You don't have to keep on, keeping your head under the sand or keep maintaining, kind of staying in panic mode. Like I said, Blueprint Way is the business where I counsel and I coach, and right now I'm offering a 50% discount on all my hourly rates and packages. So wishing you, get in contact if you need to get in contact, whether you need a counselor, whether you need a coach, blueprintway.com. And then a summary from the Christian perspective. Like we said, God has not given us a spirit of fear, but of power, love, and a sound mind. So use your power, use your spiritual power in prayer, in declarations, use your practical power in using your gifts to help your family and the people around you. Love people, stop being selfish, stop hugging all the toilet rolls, stop hugging all the disinfectant sprays, like share with people, and a sound mind. So remember the fact that this is a serious situation we are facing, but at the same time, God is in control. And we need to, keep the faith, but also be practical. Yeah.
Okay, then. So just stay safe, people.
Stay safe.
We will be getting better soon. Please do get in touch if you want any more advice. Guidance. Happy to help.
Anyone who's just joined us now, we can see FD Bailey and Pearl. Thank you so much for joining us. If you've got any other questions that we've not answered in the last hour, let us know and we can message you on the side. Okay. Thank you all.
Thank you.
Bye.
Bye.
Can you switch this off?